Hello everyone, welcome to this YouTube channel. My name is Oreoluwaa with a double A. For those of you that do not know, you're welcome to my YouTube channel. And on this channel, I film about faith, health and lifestyle, and you're welcome to subscribe, join the family for more wholesome content. In today's video, I'll be talking about cervical cancer. If you don't know, I am a medical doctor licensed and practicing currently in Nigeria. We'll be talking about cervical cancer, and if you do find this video very informative, please share with your aunties, your uncles, your grandma, everyone that needs to know. Okay, let's get into this video. So that you can adequately understand what cervical cancer means, I am going to break it down to what the cervix is and what cancer is. So cervix is the opening into the womb. It is almost in between the womb and the vagina. Okay, and to make you understand what cancer is the abnormal growth of abnormal cells, or the abnormal multiplication of abnormal cells. So putting these two together, we can say that cervical cancer is the abnormal growth of the cells on the cervix. Okay, and cervical cancer is caused mostly by a sexually transmitted infection, which is called the human papilloma virus, popularly called HPV. This virus has a lot of strains, but there are just majorly two that cause cancer. And this cervical cancer has affected a whole lot of women and has caused death. However, there has been studies that has curbed the death and the prevalence of this cervical cancer. Cervical cancer does not always give early symptoms. However, if you have any abnormal vaginal bleeding, you should see your physician as soon as possible. It could be any abnormal bleeding after your period, or before your period, or after you meet with your partner, like intercourse. Okay, so if you have this abnormal bleeding, please see your physician as soon as possible. There's a very effective way to prevent this cancer, and it is readily available in most countries, and you have several brands to pick from. There's Gardasil, there's Cervarix. This is not a sponsored video, however, it is something that I know works a whole lot and has reduced the risk of cancer in a lot of people. Unlike other cancers like breast cancers, colon cancers that depend on family history and all, we know that this is largely dependent on a form of virus. Okay, so we know that we can get a particular vaccine that once given, it greatly, about 90%, it prevents you from getting this cancer. What I mean is, get the vaccine before you become sexually active. That is the best way. Even if you did not get this vaccine before you become sexually active, it is still advised that you get the full dose of this vaccine. You're still helping yourself. The very effective and standard way to screen for cervical cancer is using the pap smear. And what this pap smear does is to detect any cervical irregularity as soon as possible. And this is advised that you do it if you are between the age of 21 to 30, do it every 3 years. And obviously, if you're more than 30, then you have to do it more often. This test is very easy, and it doesn't hurt as some people think it does. It doesn't really hurt, and it is not so discomforting. Your results will be ready in like 10 days, and that's it. It's better to check yourself early than decide not to check yourself at all. The beautiful thing about doing a pap smear is that it will even detect if you have cervical cancer before you even have any form of symptom or any sign or any symptom. You might not know that it's already there. Obviously, we don't want to have it, but just in case, a pap smear will pick it faster before you have any symptom. It is highly treatable once you diagnose it early. So the key is to go for your regular screening, and once they are able to detect any trace of cervical cancer in you, it is highly treatable. But the key is to first know your status, know if you have it, and then find help as soon as possible. It is highly treatable and people recover from it and they live their normal lives. If you have other questions that you think I did not cover on this topic, you can drop your comments in the comment section and I will definitely answer your question. Please don't forget to give this video a thumbs up if you enjoyed it and if you learned something. Also, don't forget to share this video with your other friends. Check out my other health-based video and I will see you in the next video. Bye.